Everyone, how's it going? I'm just adding our guest here. All right, we made it.
Woohoo!
Okay, we are live. Thank you, everyone who is joining us right now. This is my first time using Insta Live, so bear with me if I'm acting like a noob. Let's see here. Welcome, Accelerate, who is our guest,
Hello.
and welcome to. We have someone else who's joined us as well. Looks like a dancer. I see dance in your username, which is awesome. Welcome, another dancer. Look at that. Awesome. Well, you guys are definitely in the right place. My name is Nikki. I'm a physical therapist, and I am here with Katherine Millis. She is a doctor of physical therapy. I'm really excited to have her on. She's a good friend of mine. She's a colleague. We did our fellowship program together through IAR Institute for Athlete Regeneration. So super stoked to reconnect. I know the pandemic has kept us kind of far. Haven't connected with you in a while. So super excited to connect on here with you. All right. So Katherine, so you have quite an extensive background, and I don't actually know that much about your dance background, so I'm actually really excited to learn a little bit more about your dance history. So I do want to start with your PT background, because you're with Accelerate, your company, you are a physical therapist and you're helping dancers, so it's a very specific niche. You definitely have to have a strong, not only professional side with PT part of it, but also your dance side, which is really awesome that you've kind of combined both of those worlds. So tell us a little bit about your professional background, just to get started.
Sure. Do you just professional or education? Like, what is your...
Yeah, like tell us about, so you have a lot of letters with your names. Tell us about those letters.
Okay, yeah. So, yeah, as like Nikki said, we met in our fellowship program, which was super awesome. We were partners. Loved working with you. But yeah, so I school for a little bit, went to the University of Missouri for about a year and a half with my major in journalism, actually. And I had some great dance opportunities while I was there. Realized that science, biology was my passion. So I wound up changing my major, moving back to the state of Texas, and went to Texas A&M and majored in kinesiology. And that's where I did all of my prereqs for PT school, and then applied to PT school and went to University Incarnate Word in San Antonio, and was there for it's about a little under 3-year program. Then from there, just couldn't get enough schooling. So right when I started working at IAR, I think all of us physical therapists know that, like, when you're in that mode, just get it going.
Yeah. Did you start right after you graduated as well?
Yeah, so, well, no, I was studying for boards in the summer. So I finished PT school in May. And then I prepped for the boards for a couple months, took that in July, and then started working in August. And then that same month, I started and applied for Institute of Athlete Regeneration, where I started my certification of sports and orthopedic manual therapy. And then from there, after those exams and fun stuff, went into the fellowship and did that. And so finished that actually in February of 2021. And here we are. So
that's amazing.
Yeah. And I'm so happy we met on that journey, because honestly,
I know.
That worked.
Absolutely. Yeah. It was definitely great connecting with you, and then some of your classmates as well. So yeah, I mean, and that's an amazing move. Like, I enjoy talking about fellowships and things like that, just because a lot of people don't know what it is, and it's such a valuable asset to the profession to continue your education. I remember before PT school, I used to shadow fellows, and that's when I really fell in love with, like, oh wow, this is amazing, because they're so great at differential diagnosis. They just think so differently, especially with those cases that are maybe more tricky to solve, or having trouble getting results. So I remember connecting with fellows early on, and they would tell me things like the fellowships are for people who are just crazy, because who are just really passionate about what they want to do. Because why else would you spend another 2 years like on that, paying more money. It's not just the 2 years. Sometimes it takes longer than that. But yeah, additional education while you're working full time. It's definitely a grind, but I think it's awesome that you did it right out. I did that too, and I was scared to do that a little bit because I had heard a lot of fellows doing it later on in their career, but then getting started right away, I think it was definitely an asset. And it just continues to marinate, right? Like the more years you practice, you're like using all that information. So that's really awesome. Tell me about a little bit about your dance background. So this I don't know much about, so I'm super excited to learn about this. When did you first get into dance?
Yeah, so like most dancers, very young. I started when I was 2 or maybe 2.5, around there. You know, with your basic ballet and a little bit of tap, but did studio dance like my whole life until I was 18. Did company in high school with my studio. So that basically just means that we did special performances and events, and we just were a select group that really were passionate about dancing and wanted to push ourselves to a different level. And so I really enjoyed that. And then during those high school summers, I auditioned for different summer intensives. So in dance, summer intensives are a great way for to really grow and challenge ourselves because you get to dance with other people from all over the country. So some of my favorites that I did was one of the first ones I did was at Texas A&M. They have a great summer intensive, which is really fun, and allows you also to get the opportunity to see like what their program is like. And then another one that I really enjoyed was ABT, and that one I was thankful enough to be able to do the one in New York. So they place you based on city, and I just felt really grateful to be placed there. And so I spent a month there dancing a lot. And it was just amazing because the talent was unreal. I was like, these people, like, just put me in the back. Like, they were just amazing. I just really respected them so much. Then went to University of Missouri for a little bit. And so during that time, it was a big transition. So I really just spent some of my time at a local studio doing jazz tap, and then they had a contemporary ballet company, Missouri Contemporary Ballet, MCB in Columbia, and so they had just started a school. So I trained with some of their company members, which was amazing because they're super talented, and learned a lot. And then once I transferred to A&M, I was, you know, in the end of my sophomore year, it's really hard to find, especially in the dance scene in college, to join a team when you're like in the middle of your, you know, your year and also in the middle of college. But I, for, yeah, it's, but I auditioned for a company at A&M called Chara, and they are like a studio-based company. So they did ballet, tap, jazz, hip hop, and we would perform on campus at the Rudder Theater and cool stuff like that. And then I also trained with Brazos, which was a local ballet company, and they would host ballets a few every year. And so you would go and audition, and it was just really exciting because they would sometimes bring in professional ballerinas from, you know, Oklahoma City Ballet and things like that. Really, really cool roles that are just tough. And so that was an amazing experience. Oh, and also growing up too, I don't want to forget, I did cheer and things like that, and I really enjoyed that as well. Cheer, had the opportunity to be a junior Dallas Cowboys cheerleader, which was amazing. Getting to perform at halftime was kind of unlike any type of adrenaline rush I've ever felt. Getting to meet some really amazing performers, that was fun. And then PT school happened, and as you know, it is more than just a full-time job. It is tough. I tried to dance that first semester at a local studio, and then San Antonio Ballet had adult classes, so I tried to do that for a little bit, but it's overwhelming. So
Definitely.
Yeah, it's a lot. But once we got into clinicals where we had a little bit more time, I would drive to Houston to start taking more pro cheer type dance classes since I started changing my goals for what I wanted as a dancer. And so taking a lot of prep classes and those things. And 2 years ago, I auditioned for a semi-pro team here in Houston called Powerhouse Dance Team, and we would perform at different events. We're kind of like contracted almost, so like events in Galveston, things like that, like cool paid events where you just learn choreography and you get to dance, and I absolutely love it. And I'm still on the dance journey. It's audition season, y'all, so you know we're working, we're and that's it. Yeah.
You're like, that's it, even though that was like a lot.
to like overdo it. I just want to like give the summary.
Yeah, no, that's a great summary, but I think like as a listener, I'm hearing a lot. Like that's a lot of dance experience. Um, I've done dance before, but it was like one genre and it was like Indian dance and it was like college competition. That's it. Like that's my extent of dancing. But that's amazing.
No.
Yeah, like I remember I didn't know you were a dancer until like towards the end of the fellowship, and then you started. I saw you posting things, and I was like, "Oh my God, she's like a pro! Like this is amazing." Because you just never like talked about it, but that's so cool. By the way, if anybody is joining us live right now, feel free to drop any questions you have for Katherine down below, and we'll make sure that we answer those at the end. I know some people already asked questions before this, but again, if you're live, feel free to drop any comments or questions and we'll check those out towards the end. But coming back to what you were saying, yeah, that's amazing. Like I know in grad school, we didn't really hang out much. I mean, it was like our hangouts or our time off was us meeting up to study, essentially, like at coffee shops or whatever. So that's amazing that you even got a little bit of dance in, because it's definitely tough. So, well, that's really cool. So did you know that you were going to kind of combine your dance and PT together, or is that something that happened afterwards?
That's something I've always wanted to do. I thought about it even when I was in PT school, like how I felt was a really untapped patient population or athletic, population. But I anticipated starting my company as soon as I did. After getting that experience in that outpatient setting, it really opened my eyes to like, wow, is this how my life's going to be the rest, forever?
Yeah.
Exhausted, burned out, not feeling like you're providing the best quality care, right? Like, you've been there. And so
Right.
I had a great encouragement from my husband and family, and they're like, hey, like, you should do this, push it. And, the pandemic happened. It was just craziness. But
Yeah.
I started, when I did. And I know I eventually wanted to do it. I just didn't know it'd be this soon, but I'm happy I did because I felt ready. So
Yeah.
yeah.
That's amazing. What do you think made you feel ready sooner than you thought you were going to be?
Like, why did I feel more ready?
Yeah.
I think after doing the certification and fellowship, I really was able to learn a lot of great techniques, and having amazing mentors too as well. Really just helped me get that mental mindset to be like, I feel ready to treat this unique patient population, because we know doctors, they're unique. They have a lot of injuries that aren't easy to treat. And so I felt like time based on what we've learned, because it's a great program. We learn a lot of.
Yeah, absolutely. Yeah, I do think like IAR does a great job with athlete specific treatments, which are very, very detailed, like in terms of the performance or the specific movements the athlete's having trouble with, things like that. So yeah, I can totally understand that. Yeah, I think the IAR fellowship combo with you working with dancers is pretty cool. Awesome. So tell me how you kind of got started. Like you kind of shared a bit about you were working in outpatient and then you transitioned into your own company. So tell us a little bit about that.
Yeah, and I feel like you can relate to this too, and I'd love to hear your thoughts as well. But, as a new clinician, I think it's really great in general just to go work in an outpatient setting, because you get exposed to so many different types of injuries and diagnoses and things like that. So I started with a national company for outpatient. So you see a lot of post-op, chronic pain, things like that. And at first, you're really excited. You're so hyped to start working. These are your patients. You're super excited to contribute and help people feel better. But over time, it really wears on you, because typically in outpatient, you see 2 or 3 patients an hour, and 8 hours a day, every day. Sometimes if you would have to see a new patient who had surgery, you might have to see them during lunch. And so things like that, it was just, it's exhausting. And personally for me, I felt really guilty. I felt like, man, people are coming in and paying me to give them treatment, and I feel like I'm not giving my best because I'm not getting the opportunity to do that, because I'm having to split my time between so many people. So for me, I didn't feel comfortable with that. I didn't feel like it was fair to the patient. So I was like, I don't want to do this anymore. I don't want it to be like this. Everyone should be one-on-one, in my opinion. they should be the sole focus, and I want you to feel like your money was spent. And for me, that was the big turning point. I was like, I'm done, you know, I just
Yeah.
can't.
Have you noticed, like, on that point, this is something I've noticed. I'm curious if you've noticed too. So I've also worked in this setting where I'm seeing 2 to 4 patients an hour. Am I proud of that? Nah, not really, but you know, so it is a good experience. Like, it's a great learning experience. It makes you very fluent and you really pick up stuff, especially after going through school and being new. So I think it's a great experience to have. But I did notice my treatments are more efficient with that one-on-one time. I don't even need the full hour usually. Have you noticed that as well? Do you feel like your treatments are more effective and efficient when you're not seeing that many patients at a time?
Yeah, I think there's so many pluses. I feel like it's not only more efficient and more effective, but I feel like it's more detail oriented. And I have the opportunity to get feedback from people, to be like, I have the chance to actually talk to them and be like, okay, how are we feeling now? We can reassess. You know, okay,
Right.
not there. Let's keep working on this. You know, I don't feel rushed. I feel
Yeah.
like, and then also I feel like it brings the patient, you know, comfort, knowing that like, okay, she's not stressed, so I don't need to be stressed, you know. So yeah, I totally agree with you on that. I think it makes everything more efficient and effective, and allows for better patient results. So I agree.
Right.
Yeah, definitely.
Yes. So this brings us to a topic that that's interesting because it's like the difference between those you know, those experiences where you have to see that many patients an hour versus where you can actually channel more one-on-one time and really have that time to be an expert for your patient or your client who's in front of you with their goals. So tell me, why do people choose, or why should people choose to seek a specialist and go with maybe a more private pay option versus using their insurance, or making insurance a priority over seeing somebody who's specialist and will see them one-on-one?
Yeah, so I think this is an area that we're really trying to promote education on, especially for all of us who do cash-based um,
Right.
or concierge services. So I feel like it depends on the patient first. I kind of have them isolated into 3 categories. So for me, I have the one patient, you know, if they don't have insurance at all, they automatically get this option of working with someone cash-based one, which is awesome because they don't have to go through this other experience that maybe isn't as pleasant and kind of almost be bitter towards therapy. I have clients that have done the outpatient, use their insurance, and were like, man, I didn't like the type of treatment I was getting, and then seeked out concierge services and were like, this is amazing, and I'm seeing results so much faster. But if you're somebody who has insurance and is on the fence about using cash-based, what I can say is that we have so much more flexibility and focus on your care versus having insurance as a distraction. So insurance can be great for certain diagnoses, or like an example I can think of is if you have a surgery that requires you to go in 3 days a week, and you're just doing range of motion and stretching. For that, you know, I'd say concierge can get pricey, and you can get good care those first couple months or weeks doing that, and then eventually transfer over to concierge care when you start working towards like those big line item goals. But if you're someone with insurance concerned about concierge, what I can say is that we get to make your plan of care unique to you. We get to determine what is best for you based on what we find in your session. And it's not being dictated by an insurance company saying, I'm only giving you this amount of visits or limiting this amount. I hope you feel better by then. Good luck. And a lot of times it's like that. And I can't tell you how many phone calls I've been on the phone, you know, phone calls I've had with insurance reps and things where I used to work being like, okay, I know you only gave me 4 visits for this chronic low back pain, but it's not enough. And if you've had chronic low back pain, you can't get better you can't see enough measurable gains to discharge somebody, especially if their time is being split with another person. Now, maybe if
Right.
it's constant care and it's one-on-one and we're getting really deep into the problem, 4 visits might be enough, you know, because we're really able to delve into what's causing your problem. But I will say overall, concierge cash-based gives you better quality of care. I can't say this 100%, but most of the time you get quicker results because your care is more efficient. And in the end, you actually are saving money because even though you may be paying more per visit, you're having less visits because they're more efficient. So say copay's $90 and you're going 3 times a week. That's, you know, a lot of money, right? Versus if you have one visit every 2 to 3 weeks, that's like 120, 150, and your results are better. So I think it's just trying to educate others. And I'm not trying to be too wordy. If you have any input on that.
There's a lot of words for this topic, so it's hard not to be wordy. But no, I agree with you, and I've kind of found similar things. I don't know if you've read there's an article by, I forgot his name now, but it's a JOSPT article, and they compare fellowship and residency training and outcomes. And I won't talk about the residency side, but basically, like, fellows have, they found that fellows have more efficient results with their patients. So yeah, it really does make a difference. It's also a matter of seeing a generalist and specialist. You'll see that a lot of your specialists, even outside of the physical therapy profession, they might have more private pay options just because they know that they can treat you at a very specific niche level. And I'm assuming that's kind of what you're working with too, because since you're working with dancers, that's very specific. Like, I can't imagine being a professional dancer and going to an outpatient clinic where I'm seen with 2 or 3 other patients who are just the general population versus you working specifically with dancers. You know, so it's kind of like other athletes who have a specific sport that they're playing and they're getting specialty treatment to take care of their health and their performance so they can reach their outcomes that they're trying to get to. Or like if they're competing, like they want to win, right? Like, that's the whole thing. So it's like working with a specialist who not only has the educational knowledge and background to help you with that problem, but they're also experienced in that sport or performance type themselves, right? So yeah, I see that as another reason that people also pay cash versus using their insurance, is like they have a real issue on their hand that's very specific, and they need to see a specialist, and they're willing to pay for that because it's worth it for them.
Yes, I love that you said that. Yeah, because for instance, the best example I can also give too, if you have a dancer hip pain, right, and they like go into an outpatient clinic just to see a generalist, and they're like, yeah, so when I'm doing adagio and I'm doing developé and écarté, I have hip pain. Cool, like,
I don't know what those words are. That's why I would send dancers to you and not see them myself.
And like the dance PT, the dance specialist is like already in their mind's eye seeing the movement and thinking about, okay, where's our alignment? Where, you know, what muscles may be weak or strong, what where maybe have muscular imbalances. Already thinking about all these things because we already know the movement that's happening. And just like you said, with any other sport, right, they're working with sports specialists for their specific activity. You know, professional basketball players are working with people who know their sport and their activities. Dancers deserve that as well.
Right.
And even though they can be great in a lot of ways, treatment's just so much more efficient, and I want to say results are better because you.
Yeah. I think also, like, when you're working with a specialist, they are already thinking about, especially like with athletes, they're already thinking about the performance part of your rehab. Whereas, so insurance is created to help you recover from like the rehab part, like the injury part, and help you treat something that's wrong, treat a diagnosis. However, it's not there to necessarily pay for preventative services or improve your performance. So for people or clients who are injured but also have a goal that they really need to get back to, that's another reason to realize that, hey, yes, insurance may cover a certain extent, but what's your actual ultimate goal? Is it just to recover from your injury, or is it to improve and get back to your performance and prevent that injury from ever happening again with the movements that you're doing on a regular basis? There's so many things we could talk about when it comes to insurance versus cash and services you can provide. But I'm sure, like, just with the example you gave also, it's like there are these specific dance moves, which I don't know what you said. I have no idea what terms you just used, but you already know what they look like. You already know in your mind, like, okay, what's the performance piece that's going to be important to rehab after the actual rehab part is over, right?
Good point. I'm so happy you said that too, because like insurance, like you said, they're trying to get you just to like the bare minimum. Like, okay, you broke say someone, let's see, shattered their kneecap or something, and you know, insurance is like, okay, we just need them to be able to like put weight on their leg and like maybe walk to the bathroom, but like maybe they want to go back and play soccer. Whole quality of life is so important. Like, I'm sorry, I don't
Right.
to be just about trying to get to the bathroom on my own without using like crutches. And I just think that, you know, people who aren't in medical necessarily don't see the side we see in those limitations. Again, you've made so many awesome points. Like, I wish I could just like put these on little posters and things.
Well, luckily this is being recorded, so
Yeah.
you should totally do that afterwards.
Perfect.
Yeah. Well, that's good. Yeah, I always like, I think it's a really interesting topic. I love talking about like insurance and cash. Like I hated insurance before. Now I understand it better. So it's more fun to talk about it and really understand the nuances of it. But yeah, like a great example is also like with Medicare, it's like they cover what you need to be a functional human and nothing more than that. So if your goal is to be to get any far past that, no, there's no hesitancy whatsoever with like pulling out a few extra dollars to get you to your goal, you know, that you're actually trying to get to.
Right.
Yeah. Okay. So tell me this. This is a lot. You've done a lot in your career already, like just, you know, like from the beginning of your career after you graduated. What has been your biggest hardship and what did you learn from it?
Oh, wow. That's a really good question. I think one thing that's been really tough is I think as physical therapists, we have this whole mindset of wanting to fix people and help them feel better. And I know for me, I care so much, and as multiple therapists do, care so much about patients and having them feel better that it's so hard sometimes if they don't feel better rate that I'm hoping they will, because everyone's body's different based on stressors, external factors, all these things, activity levels, even if they're not doing their home exercise program, right? I think it's so hard for me personally to not take responsibility for that and have the burden of like, I'm the reason you're not getting better. And that most of the time it's a two-way street that I have to have conversations with people sometimes like, I can only give so much. You have to meet me the rest of the way. You have to do your part. But I'd say that's probably like one of the biggest hardships I've had is taking that burden if people aren't getting better fast enough or where they were. I feel like I have not done my job, even though it's so much more complicated than that. So I would say that's probably one of my biggest hardships that I deal with as a therapist. What about you?
Yeah, I think that's a great one. I wouldn't have thought of that, but that definitely, like as a clinician, I would say that's a really big, that's a big emotional hardship when you're just getting started and you don't know. I think now I know when my patient's not doing their part. I never like make them feel guilty because that's counterproductive, but it helps you know like when you need to work on your stuff versus them working on their stuff, right? And we're always trying to be better clinicians, but you're right, it's a team approach. PTs, any type of rehab, I think, is actually a very, very team approach. And the person who's coming in as the client has to be just as committed as the therapist, and at least meet halfway because that's how you get results. It's definitely not like just taking medication. It's you know dosed out, and the homework has to be done for it to work. So I feel like that's very common within all rehab and therapy professions, actually. So yes, I would say like if I had to talk about my hardship, it would be more related to the business side because that's been really challenging. Um, but yeah, I have had times where I'm like, ooh, is it me? Is it my fault they're not getting better? I can't tell. Like it's hard to tell. But I think it comes with experience and you get better at really like you figure out the patterns, you know, like pattern recognition, that kind of thing. And then you can have those conversations with your clients because you want what's best for them and you have to keep it real with them. They have to do the
Right.
work. So,
Right.
yeah,
Yeah,
that's a good one.
yeah.
Okay. Tell me, who is your favorite type of client to work with?
Oh my gosh. Okay, so my favorite clients are the ones who actually do their part because I feel like every patient I've worked with who actually does their home exercise program or even, you know, listens about the activity restrictions, like I can't put a percentage on it, but a high percentage, I want to say like 95%. I can't give it 100, right? But I feel like they really are so happy with the results that they're getting and the relief that they're feeling. So I love working with clients who understand that like it is a team effort, and who also are aware of the fact that like when they have an injury, it's not going to feel better immediately. Depending on how long you've had it, having that like emotional and mental awareness of like, okay, you know, I've had this injury for like maybe 6 months to a year, and I know that it's not going to be better after 1 or 2 visits. And being, I think, aware of that also helps with recovery, because you have that, you know, that realistic mindset that like,
Right.
you know, it's going to take
Yeah.
time, because the tissues in our body take time to recover. And so I love working with people who have that open mindset, who are like, okay, I got to do exercises. I know this is going to take some time, but I am here for the ride, and I'm willing to put in the time so that we together can get, you know, them to their goal. So I love those types of clients who I can have those conversations with, and they're that open mind.
Yeah.
Yeah.
That's definitely helpful. I think something you brought up earlier, like activity modification, that's a huge thing. It's so crazy because I think when people come into physical therapy, or even like with what you're doing with dancers, a lot of people have this preconceived thing that they're going to be just doing exercises to help with their issue. But it's so crazy. Like activity modification is one of the first things that I like. Sometimes with the eval, all I'm giving them on the first visit is to change one activity, and it changes everything, you know. And so but that's where that expertise comes in, like with you, with your fellowship. It's like, you know what that patient needs, and if they're just receptive to hearing you out and working on those things, hey, you know that the results are going to happen. So of course it's exciting to work with those clients, because you know that you're going to be able to make a difference for them.
Yeah.
So that is really cool. I know you've been doing, you've had your company Accelerate Physical Therapy for a little bit now. So tell me, has there been any clients that you've worked with that you had really amazing results with, or that like you had a really great experience with?
Oh man, everyone is so special that I work with.
I'm sorry, I'm making you choose. Well, you don't have to, but if you've had any really interesting experiences, I would be interested to hear about that.
Yeah, I mean, I can think, I have one patient in particular that I'm working with right now who I really enjoy working with. I'm trying my best. I don't want to HIPAA, but this one person in particular is really doing everything that they're supposed to do. I mean, we're working regularly. The home exercises are being done. The results are being seen. The mindset is there. The body awareness is there. And for me, I just get really excited for this particular patient that I'm working with right now.
Yeah.
Being able
What
to
kind of dancer are they?
why not? I work with a lot of contemporary style dancers and classically trained dancers. So I'll say that. Older than more advanced level dancer, with the pursuit of dancing professionally, but currently is at the collegiate level. So
Okay, that's really cool.
that's all I will say at this. I really want to be so protective of everyone's information.
Yeah, absolutely. Totally understandable.
Yes, but I love working with this one particular client. But in the past, okay, this one, I'm trying to think. Oh gosh, it's so hard.
You don't have to. It's cool.
It wasn't with my company. It was one of the last patients that I had before I left.
Oh, okay.
Yeah.
Yeah.
Because it was a really big journey. So long story short, this one patient had severely injured or broken his leg playing volleyball, like shattered it pretty much, like really bad. And we literally went from him not walking at all. This guy's young, okay, not walking at all, to walking, to eventually being able to jump, and then eventually wants to go back to playing. That was a really cool experience, because when you hear you've shattered your leg playing sand, and you're like first off, how does that happen? You know, sand is supposed to be pretty relaxed.
Was it like a tibia or? Okay, gotcha.
Yeah, exactly what was obviously wasn't there, which is so hard too. When people tell you you're injured, you're like, okay, I wasn't there, but I'm going to assume how this happened. But anyway, that was a cool experience. But personally with my company, let me see if I can think of anyone else in particular. Man, I feel like in general, I just see a lot of people who have like hip and sacral issues. So the sacrum, for those who aren't anatomy, crazy anatomy people like we are. It's part of your hips. And I think for me, in general, I have a handful of clients that after literally one adjustment, they feel so much better. Like there's barely any pain. Granted, we have to reinforce with strengthening exercises to reinforce that alignment change, but I actually can think of like 3 or 4 clients who had very similar diagnoses at the hip and like right in the back hip region, could barely move. We adjusted their hips and sacrums and then supplemented with soft tissue and then provided them with stability strengthening exercises. But right after that, like their mobility and their pain was significantly better, and seeing their reactions, it's the best feeling in the world for us.
Yeah.
And so I'd say those are a lot of favorites for me, being able to have people have immediate relief. It's
Right.
not always possible, especially if it's chronic, and you know that. So I think that's some of my favorite clients.
That's awesome. I never would have thought of, I mean, I know like things can stem from the lower back and sacrum. That's the interesting thing with working with a specialist though, is like you're having hip issues, they're not going to only check your hip, they're going to look at all of that. So that's really interesting. Yeah, I did, interestingly, even though I don't work with dancers, know that like hips are super involved with that population. So that's cool.
A lot of lower body. I mean, I think we see like definitely neck and shoulder, especially depending on the style of dancer, but I feel like it's so much lower body, hips, knees, ankles, toes. I had a dancer, because I've been working conventions with Doctors for Dancers, which is an amazing organization, and we had one dancer who's like, yeah, I think I broke my toe, and I was just, oh my gosh, and she was like, can I go back and dance? I'm like, okay, where's your mom? Like, let's talk about this. Like, safety first. Like, you don't want to be pushing yourself to the point where you just can't dance in the future, and like, yeah, is this moment more important than the next 10, 15 years of your life? So.
Right. Yeah, I mean, I think prevention is huge for athletes if they're trying to continue what they're doing, right? So that's definitely where we come in, for sure. Awesome. Okay, let's get to some questions people have had. By the way, if you're live right now, feel free to drop some questions. We're answering questions right now with Dr. Katherine Millis, physical therapist, certified in sports and ortho manual therapy, and a fellow of the American Academy of Orthopedic Manual Physical Therapists. See, it's a handful. Like that's a lot. So drop some questions if you'd like. I'm going to ask you some questions that people have sent in before our live today. So this is a good one. What are some ways to improve joint flexibility to reduce risk of injury? So I know you kind of touched on this by sharing onto your story, but you mentioned like working on muscle flexibility, but then also could you touch on what if that person's joint is not very flexible, or maybe it's hypomobile, which is what we call it. So maybe touching on the muscle component and the joint component on that question.
Yeah, definitely. So in general, dancers are just very mobile, just because we require so much flexibility for what we do. So let me answer this in 2 separate ways. So if someone's asking about like making joints more flexible, so usually if we have like a imbalance in our body, say we have low back pain, usually there's an area in our back that moves too much, and then there's areas surrounding that injury that don't move enough. And so what we want to do is try to normalize that movement, and that's where we can do manipulations, joint mobilizations to allow for more movement in those stiff segments, so that you can have normalized movement and have less stress on the area of your back that is moving too much. So for instance, I have an example of one client, again, I won't go into too much detail, but relating to the hip, really has a lot of mobility in that anterior capsule of the hip, meaning that any movements that allow for hip extension, right? Arabesque, penché, leaping, all of those things. There's a lot of mobility in the front of the hip, but the posterior capsule, which needs to be stretched when we, do knee to chest type movements and things like that, was really stiff and wasn't as flexible as it needed to be, right? So we are going to normalize that hip mobility at that joint by doing hands-on techniques. That's where I come in, so that you can have that joint mobility there, so that when you do développé or leaps or things like that with that front leg, you're not putting stress on the front of the joint where you're getting that pinching feeling and things like that. So I hope that wasn't too complicated, but like an example of when we would want to mobilize a joint, one area is too flexible or too mobile, one area is too stiff. That stiffness is there to try to stabilize that too hypermobile, area. And so we come in and promote mobility where it's stiff, and then we stabilize to try to normalize the joint mobility in general. So that was the first part, how I'd answer that. Does that kind of make sense? What do you think, Nikita? Is there another way?
Yeah, no, I think that's perfect. So yeah, just to recap. So Catherine was talking about like the front of the joint and the back of the joint ligaments. So when she says capsules, the ligaments that are close to the joint. And yes, there are certain times where maybe certain joints, whether it's specific joints like your hip or segments of your spine that are not moving as well, you just give them a little push. It's something you should get done by a PT or someone qualified. It's one of those things where it's like when people have had surgery, right? One of the reasons people who've had, for example, like a knee surgery need to go to a specialist or a PT is because they need that skilled movement at the joint. So somebody who's qualified to do that. Yes, definitely agree with that. Yeah, and then improving flexibility in general, you could talk about like the muscle component.
Yeah, so muscular. So dancers in general, like we said, very flexible. But if you're one of those dancers like me, Ayo, I was like your 90-degree girl. I was like Arabesque, 90 degrees. Unless I'm like on a Batma or something, I'm your basic. I got my splits and that, but I'm not one of those people who are doing like Arabian in, the Nutcracker and my leg crazy high. That wasn't me. So I was always working on my flexibility. So what I like to give dancers who, want to be more flexible is we strengthen the muscle while we lengthen it. So I really like to start with like what we call eccentric exercises, where we are stretching and lengthening the muscle, but we're also strengthening it. So that way, when you do powerful movements like kicks and things like that, you have the flexibility, but it's strong, so that you don't risk tearing anything or injuring any surrounding areas. So for me, I like to start depending on their skill level, but some good examples would be like what we call RDLs, resisted deadlift, single leg. Best way to translate that into dance term is like doing a penché, but you don't really open your hip, everything's square. And you use weight for resistance, so that muscle, your hamstring, is lengthening, but you're also strengthening it, and that helps with your splits, kicks, things like that. Another example would be if you're working on your splits, getting in a kneeled position on the floor with your front leg straight, and you slowly, that's not a word, slow and controlled, I'm not a grammar teacher, slow and controlled, go into your splits, but not all the way. So you're lengthening your hamstring, but you're also controlling it. So that's a strengthening component, and then returning back to the original position. So like I was saying, eccentrics are a great way to work on your flexibility, but also to strengthen so you don't put yourself at risk. Because I know a lot of dancers just push into your stretches and things like that, and that's how we get injuries, and it's so bad for us. And so that's why we encourage, see a dance specialist so we can find out what your needs are, and then, customize a workout program for your needs, so your goals.
Yeah, I love that. I love the strengthen in the lengthened position. It's definitely a more challenging position for your muscle to work with, and more susceptible to injury. So that's really cool that you're doing that.
Yeah.
Great.
Eccentrics.
Okay. Yeah, eccentrics. Okay, next one. This is great. Why should you see a PT for dance? Like, why should we even do that?
Why what you're doing? Yes. So just like you were talking about earlier, Nikita, like, when it comes to specific athletes, they're not going to just see a general practitioner. They're going to see someone who knows what the heck they're doing. And same thing for, so like we said before, dance is a very unique sport. And I like to tell my clients, like, you have to be flexible, powerful, graceful. You got to look good doing it, and be entertaining to watch, and have all of and control as well. And it's so hard to have control if you're super duper flexible. So it is such a mix of different skills you have to have as a, and so you want someone who truly understands exactly what you're doing, what movements you're trying to perform or improve, and how we can get you there. Like you said before, when you have someone who's a specialist in your field or in what you're doing as an athlete, your care will be more efficient, it'll be more effective, and it'll get you back to play, is what they say. So for us, back to dance quicker and more safely, so that you're not waiting for someone to understand what you're saying to them, so that they can create a generalized plan for your injuries. So yeah, you want someone who understands you and what you're doing, and your care will come at a pretty quick, more quick rate than someone who's just a general
Right.
specialty.
Absolutely.
Yeah.
Awesome.
Do you have anything to add on that? I feel like we talked about that a little bit.
We did talk about it a bit. Yeah, no, I think that's a great answer. The specialty care, yeah, it's even with like that with other professions, right? Like you go to your primary care physician when you have a general complaint, but then if you have something specific going on, they're going to refer you to a specialist because hopefully they do that because that's the right thing to do to get you the care of like what you really need. Somebody who specializes or is solid in their knowledge to get you to where you need to be for what you're dealing with. So same with physical therapy. If you're working with a specific sport or a specific type of movement, you need somebody who can specialize in that if your goal is to prevent injury in that and improve your performance. So, yes. Okay, we have another question here. Haven't danced in years, but want to get back into it. What do you recommend I do to prevent injury? So you kind of talked about the eccentrics and stuff like that in the first question, but any other recommendations to somebody who hasn't danced for a while and is like just really interested to get back into it? They might not be like a pro dancer, but they're just interested to, make sure they don't get injured when they do get back into dancing.
Yeah, so just like with any workout, you want to keep intensity low, start nice and easy. I think it also depends too, like what style of dance are you trying to get back to? So say you really like ballet and you're trying to get back into ballet. I think in general, I don't know what your previous workout routine is, if you are working out regularly or not. That's also a factor because I'm a big proponent of cross training, which is like a huge thing that I talk about on my Instagram. But I would say if you're starting to dance again, listen to your body and take it easy. I think it's really easy to get so excited and want to just jump and be like, all right, we're doing, I don't know, sequence across the floor, but I haven't really been strengthening my calves and my ankles are a little weak. And then, it's a hot mess just because you're pushing your body past its boundaries right now. I'd say go take maybe a couple of dance that maybe would be too easy for you to start out. So like personally, if it was me, I'd probably go take like maybe I'd go take like an intermediate ballet class and just listen to my body and see how I feel at the bar. And then going in center, don't feel the need to have to force your leg up super high or things like that. Just take it easy. Listen to your body. Don't try to go to your 100% max. Don't push yourself into your splits if the flexibility is not there. Don't try to kick your leg higher if your body's telling you I don't have that flexibility right now.
Yeah.
So, yeah.
I think like being intuitive, right, with your body, super important. It's so crazy, but so like as physical therapists, when we're examining you or doing your evaluation, that first visit, a lot of the session is us asking you questions. What is your body telling you? Like we're literally asking you, what is your body telling you? What is your body communicating with you? And then we're using that information to put together what's actually going on. So same thing like with what you're saying, paying attention to what your body is telling you when you're working out or you're doing your dance stuff, like being mindful and listening in is a great way to prevent injury. Really great way. It sounds so simple, but sometimes the simplicity is where the money's at. So yeah.
I agree with that. Yeah, just take it easy. That's what I can say to you right now. Eventually you got to jump back in, but take it easy. Make sure you warm up before you even start dance class. Get your body, do some shoulder rolls, do some hip rollouts, just like, prance in place, just help your body as much as possible and take it easy. You'll know what feels right and what doesn't.
Yes, ma'am. All right, we got a question in the comments. It is, what are your thoughts on calisthenics? Did I say that correctly? Calisthenics and PT. Would you see a dance PT if you're doing calisthenics?
So I know calisthenics can mean a lot to everybody. So if you don't mind commenting on their like specifics for what you mean as calisthenics, because I know that word kind of means a little bit different to everybody.
To me, I don't even know what it means. But yeah,
if you don't mind, just like on there, like what you consider that to be, just so I'm on the same page with you, so I can give the best answer possible. Um,
Yes, so feel free, Jigna, if you want to add in what type of calisthenics, and Catherine here can help answer your question on that.
okay, so just body weight.
Yeah.
Okay.
Oh, you can see the comments. Great. Yes.
What are your thoughts about MPT? Would you see a dance PT if you're doing this? Yeah, okay, so body weight exercises. So in general, I love to use body weight exercises for like a pre-warm-up for dance classes, because for me, I don't consider myself old, but I've definitely like hit like a peak, and I like have to do body weight exercises before I even start a dance class. So I guess it really comes down to what are your goals. So you're doing body weight exercises. Sometimes can be also including tempo change when lowering or raising. Yeah, that's what I've known calisthenics to be, like different speeds of activities and exercises, dynamic movements. That's kind of what I've known calisthenics to be. I guess it really just comes down to like, what are your goals? You know, dance PT, yes, definitely. That's what I'm familiar. Yeah. Yeah, so it really just comes down to what your goals are. You know, what are you trying to do? Are you wanting to work on a specific goal where a dance PT can come in and help create you an exercise program to help you reach those goals? Are you wanting more activities to help add on to your current workout program? Do you have pain with these exercises? And if you do, you know, then you'd want to see a dance PT to check your form. You know, why might you be hurting during these activities and exercises? And how can we adjust these exercises so that you can still do what you love, but not have pain? So I think at the end of the day, you know, you don't have to see a dance PT if you're doing calisthenics. It really comes down to, are you having pain when you're doing them, and what are your goals? Are you trying to improve a skill, change up your workout routine, want your form checked? Does that answer your question? And if not, please let me know, and so I can answer it.
Yeah, you can reach out to her at Accelerate PT, right? On
Yeah.
Instagram. Cool. Okay. Great. Let's see. I think that's all the questions. If anybody else has questions, you can feel free to reach out to Accelerate PT, aka Dr. Katherine Millis. She is happy to help you out.
Yes. Let's see. Let's see. Okay. Yeah, progression is limited by pain and not knowing what I'm doing wrong. Yeah, so if you're having pain with these movements, yeah. So yeah, no worries. If you're having pain with these movements, you definitely want to have, you know, that checked and see what's going on. Is it really just your form, or is there something else going on? You know, do you have some kind of musculoskeletal or biomechanical issue going on that just needs to be addressed and tweaked by a PT? So yeah, that's a really good question. That's a really good question. Thank you for sharing that. Sorry, Nikita. Go ahead.
No, you're good. This is what we're here for. This is awesome. Yes, thank you for sharing your questions. Thank you for sharing the answers. That's really cool. I didn't know what calisthenics are. Now I have a little bit of a better idea.
It's like I like know the word from like one standpoint, but I know that, like, you know, there's some words that people have different meanings
Different, yeah, understandable.
for this.
Yes, ma'am. All right, so that is all I got for today, and that's all the questions I had to. What people are you serving? Are you serving anybody in Texas? Are you sticking to Sugarland? What's your service area look like?
Yeah, so I drive all over the place. This week, let's see, I was in Woodlands, Hockley, Spring, Channelview. I was all over. So I travel to my clients. I will
Nice.
go out of city for like master classes or things like that, or if I have like a group of clients, I can book them all. So I have treated in Dallas and in Austin. So if you own a studio, or you know, you're part of a school system or university and you want a master class, or you know people who need treatment, I can come out of the city and visit you and make that work. I also do virtual like consults and evaluations like that. So if we don't necessarily need a lot of hands-on, but you need more feedback about your movements and things like that, we can do too. So yeah, so pretty much
Awesome.
most of Houston. It depends like how far, because I do travel all over, so I have to make it flow with the day.
Yeah, absolutely. That's cool. Yeah, that's good. You mentioned like virtual. So a lot of people don't know how that works, but it's very cool. Like you basically use, I mean, what I've noticed when I do virtual is like using more movement-based assessments. So physical therapists, especially like with the training that we have, where very, very intuitive with like looking at movements. We could tell you from your squat, we could tell you like 25 different things that are going on from one squat. So I'm sure that looks really interesting with dancers as well when you're doing that virtually.
Yeah.
Very
So
cool.
we're about to get off, but like one of the things, you know, we learn in school is we like to watch people's gait. So basically how someone walks.
Yeah.
And like, I'm like, I know this is awkward, but like, just please walk for me. And I think people are just like, I don't know how to walk. Awkward, but I promise this tells us so much about how your body's moving, you know.
Yeah.
Anyway, I just, when you said the squat, so many things we can see. It's crazy. Yeah. I mean, we think of watching people walk and like figuring out what's going on with their body.
Yeah, it's amazing. All right. Anything else you want to add for today before we wrap up?
I don't think so. I think just like, you know, if you have questions or concerns in general and you're seeking a physical therapist, whether you're a dancer or you're not a dancer, I encourage you to find a physical therapist to reach out to in your area and get it addressed, because at the end of the day, injuries, you know, it's your quality of life. So if you have a chronic pain or injury that's been bothering you for a while, please, and just get it addressed now so that it doesn't become something bigger later, because you want to have the best quality of life possible.
Yes, I so agree with that. Okay, you can tell us, where can people find you online, or what's the best way to get in touch with you?
Yeah, so Instagram's great. You can DM me. Also in my, just threw a pen. Okay, link in bio, I have my link tree. And so you can either book an appointment through there, or my email and phone number should also be in my bio, so you can always call or email us. My website also has info, but best way is through Instagram DM, or you can email me or call. If you're having trouble finding that information, just DM me and I will send that to you, but it should be in my bio.
Awesome. All right. Well, thank you so much for joining us live. It was so great to catch up. It was great to learn more about your journey and what you're doing. Again, everyone, if you're live, this is Dr. Katherine Millis, physical therapist, doctor of physical therapy, certified in sports and manual therapy, and a fellow of the American Academy of, I really think they should make it shorter, like it's just too much for me. Only 1% or less physical therapists in the United States are fellows. She's extremely qualified. Hit her up if you're a dancer and you're trying to get somewhere or fix something. She can help you really well.
You're awesome. It's so good to talk with you, and like we need to like actually go get like coffee or something or tea.
We need to. Yes, let's do it.
It's so good to thank you for having me on your Instagram and everything. And yeah, and I know
you're so welcome. I enjoyed it. This was a great first live for me, so appreciate it.
Yes. Yeah, she should save it. I think Instagram saves it, so she should have it on her page.
Yes, it will get saved, and we will share it. So I'm going to share this on my YouTube channel, and I will make a post about that a little later on.
Sweet. Awesome. Cool. Thank you so much.
All right, you're welcome. Thanks for joining us.
Yes, you have a good weekend.
Thank you. Take care.
You too. Bye.
Bye.